news is that the flagship of the commission, which is our rural medical outreach, has recommenced. It's been a long time coming, with all the communities asking for it. We commenced yesterday in Akwa Ibom State at the Cottage Hospital, Okana, in the Senudin local government area. And on the first day, we had about 30 surgeries. We had 2 cesarean sections, 2 myomectomies, that's removal of the fibroid. These are surgeries that will cost anywhere from 400,000 to about 2 million, depending on what facility you're using. To imagine that NDDC has given these surgeries to these people absolutely free. That can give you a true picture of the impact of what we're having in the commission. Healthcare is not a tangible, bankable project like building a road or putting lights on the street or putting a jetty. But the impact actually gives you the highest mileage in terms of what you can achieve. In a week, we treat about 5,000 patients, and we have about 10 to 15,000 encounters, in that week, in the sense that one patient may get to see the physician, get to have their eyes checked, get to have 4 or 5 laboratory tests, and get to go home with medication. The cost of antibiotics has gone up over 10 times in the past 9 months, and we're giving these things free. We've planned 10 medical missions. Like I said, we started with Akwa Ibom yesterday. Next week we're going to be in Imo State at the Niger General Hospital. Then on May 5th, from May, we'll go to Otu Jeremy, the General Hospital, Otu Jeremy, Lugedi North local government of Delta State. And then we'll move to Edo State, General Hospital, Auchi in Edo State. Take a break for a week. We have another team of doctors going to Ondo State, General Hospital in Bokoda. And after that, we have another team going to Abia State, to the Cottage Hospital in Owaza, for our West local government. And then Cross River, June 16th to 22nd, we have a team going to the General Hospital Akampa in Cross River State. So for Bayelsa, we have 2 medical missions. We have a team going to the General Hospital Otuasega, which covers the Obia ethnic group, and then we hope to have one in Yenogwa to cover the PA ethnic group. Now, usually we go to the rural areas, but we're doing this in Yenogwa because that is one group that is actually neglected in Bayelsa State, because we do most of the things outside and don't come to the city. But we've made an exception for Bayelsa State. But with those 10 missions, we're targeting about 50,000 patients. And while those missions are running, we also have a new program, which is the registration of people to give them access to free healthcare, where NDDC is facilitating the registration of vulnerable people, poor people, elderly people above the age of 65, and all the children under the age of 5. We're going to register them so that they have access to the National Health Insurance Program in each of those states. These are programs that actually exist at the federal level, but NDDC is facilitating the registration because most of the time the communities do not have the funding to do that, and NDDC is partnering with someone, a group that has developed software for that, and we can monitor the real-time engagement of people.